take. But I think this is a good example of donor management on a patient who have below average donor. It's still possible, but it has to be realistic.
Dr. Kostis, thank you for joining us. For those of you who don't know, Dr. Kostis had a hair transplant with Dr. BISANGA. What has it been, 8 months now?
10.
10 months now. 10 months. Last time I spoke to you, your hair was growing in a little bit, but it wasn't like to the level that it is now.
No,
And
there is a difference now.
Oh man, it's incredible. So yeah, if you could just kind of like just give us your experience from when did you really start seeing hair growth? When did it really take off?
The transition period starts after the first month till the 5th month. So on the 5th month, you start to see some of the result, let's say half of the result, but it's still a significant result if you are northward like 3 or 4. So I remember like during the summer when people were seeing me, they couldn't believe that I had this growth so soon. But I think 5th to 6th month is the time that you should expect to see some growth, so some of the result. And now after 10 months, you can also you can see like how dense it is. Now I need a comb.
And Dr. BISANGA, what would you consider Dr. Kostis to be in terms of like a candidate, like his hair density, his hair caliber, like where would you place him?
He knows. He can say what I told him when I did his consultation.
No, I'm an average candidate because my donor, the average is around 65. I have very fine hair, so the sides need to be made very tight in order to have the density that I have now. And no, he did a good job because you can see the result, and I'm really happy and grateful for that.
And one thing that I insisted, because Dr. Kostis was not taking any medication.
Medication, exactly, medication.
And I insisted for him to get a minoxidil tablet. He was reluctant to start. And I told him, you need to take medication, otherwise everything we're doing is not gonna work. So we had to strengthen the hair that he has. Dr. Kostis has a lot of smaller follicles. So, but with quite an extensive hair loss already, because everything was thin from front to back. And I asked him to cut on his smoking because he was smoking also a lot. And that also can impact the growth. So I was on his case every day. It's like my little brother now. So I was on his case all the time to make sure that cut his break for smoking, make sure he has his minoxidil and all that. But now he's enjoying it because he didn't have enough donor. So I didn't want just to take for the sake of taking from his scalp. So because he's been blessed to be from Greece, so he has a hairy chest and beard. So we took some chest hair, because they were blending more with his finer hair than his beard that is very coarse. And so we did some chest, we did add some chest hair. His donor now
200.
His
200?
donor, yeah, because I needed around 2,700 grafts, but I felt like if I take those 200 on a scalp, I'm gonna push his scalp to the limit that I didn't want to, because I wanted to leave the scalp to heal for any future procedure. And we have taken some pictures. Now he wants to do his crown, so we'll do his crown. When we shave him, we'll share the picture of his donor and all the measurements that we'll take. But I think this is a good example of donor management on a patient who have below average donor. It's still possible, but it has to be realistic. We have to keep a higher hairline. And so a patient need to understand that and need to be on medication.